The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Welcome back to Meet the Doctor. My guest today, live in Miami, is Janet Allenby, and she's board-certified dermatologist here in town. And she is the founder of BodySquad and Allenby Cosmetic Dermatology. Welcome to the podcast.
Thank you. Thank you for having me.
Now, we've met before. Actually, one of my favorite meeting stories I met your marketing director, Bridget, first, and she walked up to me on the street and we became very quickly good friends, work friends, right? Mm-hmm. You have a really innovative practice and I'm excited to hear more about that. So why don't you just give us the overview?
You know, it's funny because you don't think it's innovative when you're actually doing it, but thank you for saying that. Well, okay, so I've been in practice for about 30 years as a dermatologist, and probably about 8 years ago, I was like, okay, I really love aesthetics, and I'm not really, when you start thinking about aesthetics versus medical, you just start like adding up, what am I doing on the medical side? What am I doing on the aesthetic side? And you're like, wow, I'm spending so much time on silly stuff, prescriptions, all these other things that, just take up a day if you're practicing medicine. So I decided, you know what, let's do the aesthetic route. And I did not look back. It has been just a wonderful, wonderful life. And I've just been so blessed to have fantastic people in my life, whether it's my employees, my people like Bridget, who you met. I really have been so fortunate at the patients, and it's kind of funny because my medical colleagues will go like, oh, how do you do aesthetics? The patients are such a high maintenance. I'm like, these are like the coolest people. I have met so many fantastic people, which helped me innovate my practice. So most of my practice stemmed really more from, I was very strongly into facial aesthetics. Again, I grew up as a cosmetic dermatologist. It wasn't a field when I started. And well, what happens is I'm kind of following my own trends. My face is falling apart as I'm aging, and it is the natural progression. And then your body starts falling apart. So that's where BodySquad came in. And I was like, it's at the same time technology was catching up to these needs. And that was kind of how I've been happily enjoying my day-to-day. I go to work on Monday and it's my weekend for me because it's like, this is so fun. I can't wait to go back. So, I really have been very lucky because I have a tremendous amount of patients. I saw with that kind of patient load, you really get to kind of experience things maybe others are not able to get. Sometimes when you have a lot of experience in a field and you have a lot of reputation, the companies do come to you with things earlier than they will with others. So I really have been very fortunate in making strong relationships across the board with pretty much everybody in aesthetics, and it's patient-centric. It's not because I'm a representative of those companies. It's more to really make sure that the patients are well taken care of. And is this something that's going to deliver them a better service? So I don't marry myself to any one company. And I think that's really a huge thing that is important in our field is, I'm married to my patient, not to the companies. And it's a team effort. Even my entire staff, it's a team effort from the person that you talk to on the phone when you're making an appointment to the nurses that are bringing you in. Everybody's invested in it. They all just enjoy it. And it's something that brings everybody great joy every day. So that's my, innovative practices.
I'm trying to imagine you looking around like, okay, I'm doing this, but knowing that there's a cosmetic practice everywhere you turn in this market, all over South Florida. So at some point, I wonder if you said, here's how I'm going to do it differently. And what did that look like?
Wow. I don't pay attention to other people, and I don't know if it's good or bad, honestly, but I really think that I know there are great people out there. And actually, those are my colleagues that I talk to, and they're the ones that I can learn from. So as far as that goes, the level of wow out there is not where I would love it to be. And I want to be the wow. So I'm always like trying to strive to make sure we're the wow first. And there has always been some sort of competition. But I think if you practice to the level that is higher than the normal standard in the community, I think everybody would be successful that way personally. I'm always kind of looking of what's in the future. I'm a future looker. I definitely live in the present, but I'm watching the future to say, hey, this is where we need to go.
So you sound like you're a bit of an early adopter, maybe a cautious one, but you have this very long dermatology foundation that you probably, I'm putting words in your mouth, but I think you probably make your decisions with all of that expertise behind it. You're not just picking any one new thing. How do you look at these new technologies and decide what you're going to take on?
You're correct on some degree of that. I will say, okay, so again, I get presented with a lot of different options, and the ones that are too good to be true are usually too good to be true. And, it's kind of like, I don't want to be a smoke and mirrors doctor. This is not snake oil. It has to have some real data behind it. So when I really do look at something, I will maybe sit on it for a couple of years. I may not go, hey, and that's the kind of the cautious part. But when I know something is right, I don't hesitate to go forward with it. Like Ellicor, I watched it for about 4 years. Got it about not quite a year ago, started using it, and wow, I am so impressed. There's definitely a learning curve with it, and you have to really learn how to use the device, but it is incredible. It's you can really utilize it. If you're having people who don't want to go for surgery or can't go for surgery, this is a device that I think will really help people out.
I've heard that it's great around the mouth where nothing can touch that area.
When you're thinking about, okay, I kind of always reflect, what do I want? I'm in my later 50s looking, hey, do I need a facelift? Okay, I don't want a facelift. So what do I do? And when you're thinking, hey, if I'm going to get a facelift, they're going to change the shape of the trajectory of your face. And that concerns me a lot. I don't want to look like a different person. I think I'd say 98% of the people that walk through do love how they look. They just kind of want to look fresher. So I don't really want to change the way I look, other than I don't want sagging jowls. And the mouth area really is not well treated with a facelift unless you're doing laser or some sort of resurfacing procedure. So I kind of find that the Ellicor is something that, yes, you can really remove tissue in that mouth zone. I see shortening of the upper lip. The jowls are going away. Under the chin is going away. And it is definitely, you got to pick your patients, but maybe you do 1 or 2 of them. We do tend to treat it fairly aggressively. If you're going to do it, do it. Don't waste your time on this one. And you do have some downtime with it, but you really do, like you said, it's something that is treated in an area that was not treated before. Personally, I think that you're going to see in 10 years from now, people that get facelifts will have this at the same time, because it is a totally different procedure, that we've ever had. It's not heat. You definitely have some downtime. Like I said, you have some red discoloration afterwards. Now, the other thing too with this is that I think you kind of have to be with a practice that has a lot of tools to help you recover. I've done the Ellicor myself. My staff has worked with me on it. And I had to laser out some of the red. And it's kind of like more of a red discoloration, like the blood vessels come to the surface. We call it hyperemia. And it's not the hyperpigmentation you see with like a heat-related thermal burn like you're going to have with like a CO2 laser. So I do peels afterwards. So there's a lot of support around it. But if I don't have a facelift and I don't have to go through a changing of my face, to me, that's huge. Now, I do kind of use it off-label in different areas, like maybe around the eye area. I can really reduce that and kind of lift the eyes up a little bit. So it's pretty awesome.
Not just anybody can have the Ellicor yet, though.
I mean, they are very selective of who they will sell it to. And you'd probably have to be one of the core, like either derm, plastic, oculoplasto-facial plastics.
I've heard that too.
Yeah. I think it should be. It's definitely, I think we're still trying to help them find the proper way to do it. And, there's not ever going to be a cookie cutter system. Everybody's a little bit different, but there's going to be like safety parameters, I think, that need to kind of always be observed. The discoloration afterwards that you see with that red, nobody cares where it came from. If it's a hyperpigmentation from color, from heat, or, if you're red, and you got to take care of it.
Yeah.
So you have to have a practice that can support that and get that recovered.
Are you communicating with others who are doing it too and kind of sharing knowledge?
Yeah, more through the reps more than anything. But yeah, I mean, I kind of see a video like every couple of weeks, I'll see a video of somebody else doing something, and I kind of from that, I realized we're treating fairly aggressively. When I look at other people's videos, I'm like, oh, well, what about this? But that is my MO is if I'm going to do something, I kind of say, hey, if we're going to get the result, we do need to kind of step on the gas here.
My hypothesis here, since I've only heard plastic surgeons talking about it, is that you know skin really well.
Yes.
You know what skin is going to do and how it's going to behave. And that might make you have an approach that's slightly different.
I think they definitely marketed the device. Well, because a dermatologist came up with it. So they definitely are marketing more towards dermatologists. They don't really even know the plastic surgeons so much. And I know there was a couple that were, but like there's one in Palm Beach that was kind of in the trials. You're 100% right. I have so much aftercare that I've been trying. I mean, I actually found a really awesome exosome and I think it cut the healing time in half. Personally, the red that I had the first time I did it, I look like I was like 2 weeks out by the time I got to 1 week. So it really is cutting down the downtime. You're still going to have downtime, but it's, you can recover quicker.
It really says something that you've done this to yourself twice.
Oh,
twice?
Yes. And for those who know me, I actually have really nice skin. And for me to go disrupt my skin is definitely, it's got to be worth it.
What other technologies do you have that you're excited about or not excited about?
Other technologies, other things as far as facial aesthetics, I think there is a little bit of filler fatigue going on out there. And it's not the patient's fault. It's just we haven't maximized how much filler we should put in a face. And sometimes we need to actually remove some filler, whether it's our own patient or somebody else. And we shouldn't penalize patients for them coming to us and having an overfilled face. They didn't inject it usually themselves. I think there's probably a couple of kooks out there that might. But, it's something that one, you don't penalize people. You don't charge them crazy numbers to get it out. And you start reshaping the face back to a normal, attractive look. I do like there is a Renuvia. It's kind of like a Sculptra for fat. It's kind of like you put it in and it stimulates fat growth. And I do like it if you use it in really small quantities because it does last a long time. It's almost like an implant. You put it in, but it doesn't change. Like if you had a really margarita night, you had too many nachos and margarita and you're swelling up, you don't have the problem with the swell like you do with the hyaluronic acids. So it kind of is a nice softening. And when you look at younger people, their fat pads are more continuous to the back of the face. You can really make someone look a lot younger. When you look at somebody older and they look very segmented out and you see a lot of hollowing, they might want to look skinny, but it kind of looks, skeletal and it's not an attractive look. It doesn't look young. It just looks skinny. So you're trying to help people reach their most attractive look. I still use tons of threads. I love Sculptra still. So all these other alternatives to hyaluronic acid, and we still use hyaluronic acid, don't get me wrong. And I think we are kind of in a better phase for lip filling now, where before the lip fillers were just so hard. You put a filler in that you're putting in your cheek, you're putting into your lip. And yeah, it's going to project and look crazy. So the softer fillers for the lips. I don't do a lot under eye. I could probably do more above the eye if I'm going to fill that area, like more brow fill than I do under the eyes. Under the eyes can get a little bit lumpy, maybe later, like 6 weeks later, you're like, that kind of looks a little puffy there, So then we end up having to bring it down. But, it's kind of like having that partnership with your patients. So they're comfortable saying, hey, I don't like this. And they come in and you work it out and you learn from it.
It might be a hard question to answer, but how do you build a relationship with a patient that enables them to feel like they can come back and say, oh, I don't like how this looks? Like that's not an easy thing to do.
That's a good question. I treat people like we're friends and I try to have that kind of relationship with them anyway. Like I know what's going on with their life. Even if they're new patients, I want to know who they are. It helps me understand how we're going to make them feel better about themselves because that's ultimately what we're doing. So I think just and I'm very straightforward. When somebody comes and asks me for my opinion, they may not like what I hear. I'm not really good at sugarcoating. Unfortunately, I wish I was a little bit better at that one. And I'm kind of to the point of this needs to be changed because in my mind, I'm like going through a checklist of, okay, if we do this, this is going to look fantastic. And then I get excited. So I think, they know that I am there for them and I keep them in the loop, even as I'm injecting. I'm like, look at this. Do you like it? Is it something that you're liking? If you don't like it, and I keep saying, if you don't like it, we can change this. Don't feel like you have to just
open the door.
Yeah.
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 So is this what you're known for? Is this honesty? Or do people come in saying, I heard you tell the truth, Dr. Allenby?
I actually do hear that. Yeah, I hear that. I think that people know that I have their best interests at heart. And every so often you'll have somebody who thinks opposite. And it's just like, then they really missed what the conversation was. And you're never going to get along with everybody. Sometimes personalities clash. Sometimes there's different goals in mind, my goal versus their goal. And honestly, my goal is to make them look good. And it's never about how much is this person going to make me. It's I want them to look good. But sometimes I think they're so fearful that we're out for $1. They think that that's the direction. And sometimes because they're so afraid to do stuff, they haven't done anything. So when you tell them a lot, they're like, oh, and you can also say, if you see that look on their face and that look, you can just say, hey, I'm giving you the whole picture and we can do this in segments and we'll just segment it in and try to get their priorities, what there's important to them. And maybe sometimes their priorities are wrong. And you're like, you're going to look so much better if we start with this. And then we go to that.
Mm-hmm. Baby steps.
Yeah, baby steps, especially for the newbies. Most of my people come in and just don't even, they're just like, do whatever you need. Make me look good. Like, okay. Which, it's kind of harder, honestly. I like to hear a little more input from them. I want to know what they're feeling.
Yeah. I mean, we all have a list, right, in our heads.
Yeah.
And it kind of shifts from time to time. Mm-hmm. Like, this is really bothering me the most right now. Mm-hmm. It's helpful for us to tell you what's on our list because we can't do everything in one day either.
Right. Well, sometimes we can.
Well, maybe you can.
On BodySquad area, I think it's really interesting because when I opened BodySquad, we actually had M-Sculpt and Cool Sculpting, and then we switched to Cool Tone from M-Sculpt. I liked the whole keeping, actually I liked it because it was a little bit stronger. And we had to kind of work around getting this machine to work the way I wanted it to work. And we're actually there now. So I think Cool Tone, which is that electromagnetic stimulation that builds muscle. And as a paper just came out from Susie Kilmer, it does give you functional more strength. So it is fantastic because that's the first thing I felt when I had it was like, oh my gosh, I feel strong. And then, then you start looking better. It's like, wow. So I kind of use the combination treatments. So we have Cool Tone, we have Cool Sculpting, and then we got Resonic, and then actually Allergan bought Resonic. So it's kind of all in the same family, which I'm not in love with being with one company, quite honestly. I like to kind of spread it out. And this is for body contouring. And I think now people's minds before were just like, I do one thing for the body. The face, they're okay with doing toxins, neurotoxins, and then they can do their fillers. They could do a facial, they could do a peel, but they don't really think on the body multiple things. And now you have to start, I think they're getting more comfortable with, okay, I can do some cool sculpting, remove some of the fat. I can do the body contouring, fill in the space, get some shape back to my body. And then the Brasonic is a device that helps the cellulite, which I love the machine. It is just, the results are so interesting. It's ultrasound machine that is kind of diving deeper under the tissue and hitting where the fat lies. And it's basically breaking up the things that kind of pull the tether, the tissue.
Does it have to break the skin or no?
No, and it's not even painful. It's like a little uncomfortable, but not bad. I mean, it's on a scale of 1 to 10, it's like a 2. But it actually treats cellulite. And the interesting part is when we first got it, I'm like, I know this is going to work, but because I saw like some data and I knew the people that were developing it and I really trust them. But it took about 4 to 6 months to really see the result, which is crazy.
That's a long time.
Exactly. And you're like, okay. So we kind of have a protocol that we do a couple treatments, even if they're not seeing the results, because it really, once you get to that 6 months, the skin remodels. It looks super young. The tissue just looks so smooth. But it takes a while, and it really is a tough one. It's a tough one for patients to understand. Why am I spending the money now? But the longevity of it is usually long. Like we're seeing 2 years length of time that it's lasting, but you got to wait for that time.
So you had it before Allergan acquired it?
Mm-hmm. Yep.
And who developed this device?
Okay, so the people who brought it to market were actually with Allergan previously, with Cool Tone, Cool Sculpting. They were with Zeltique, and then they went over to, it was out of Dallas, and I'm just totally blank.
Oh, I know who you're talking
Yeah, well, Brad Hauser was the one that basically was leading it, and he was the one that brought Cool Sculpting, Cool Tone, kind of with his brother to, and Mark Foley over to Allergan. So, I mean, they definitely get exposed to every technology out there. And so when I started hearing about it, we started looking at it, talking about it. I've had so many different devices for the body presented to me, and there are just so many junky things that are going to cost a fortune to the patient, because once you buy it and you start using it, most practices, like, they will use them because they got to make the money on them. So you have to be very, there are actually, I have had devices that patients never saw, and, there's $100,000 down the drain, but it's like, you cannot risk your reputation on one, because, one thing like that will actually kill you. If they say, oh, I went to BodySquad and I spent, $10,000, and that's a huge exaggeration, but, and they didn't get results. Yeah. They're going to be very upset.
Tell a lot of people and write a review.
100. Yeah. I mean, I'll be getting reviews forever on that, which I don't blame them. I would do that too.
I do see people come back and write reviews sometimes 3, 4, 5 years later, and they're still mad.
Yes.
Like they just finally got around to writing about it.
Yes. And that's kind of like, you need to go forward, people. Come on, but let's work it out sooner, not later.
Usually that's in surgery, because they're still feeling the effects of something. I was reading an arm lift the other day, and she was still in pain, and and that's a whole nother topic, but you have to resolve. So let's bridge back to that. Like when somebody is unhappy, you have to be willing as the doctor to do something about it and not just say, go away.
Oh, 100%. You really do. I mean, sometimes you wonder where it's coming from, but overall you have to take it all serious. This is, you're dealing with people's physical self. You're also dealing with their mental health with this. And we all know mental health has been on a very slim razor's edge right now of teetering, and people are really sensitive to everything right now. And it may continue forever. I don't know. I don't remember this when I was younger, but it does seem like things are escalating a lot. And I'm sure social media, as far as like, looking perfect, being perfect, thinking that your life is just wonderful and cherries and dollars are floating down to you. It doesn't happen that way. We'd have to work, we have to do all this stuff. But anyway, back to dealing with people, is their concerns are legitimate. Even if we're like, what? We still have to take them very seriously. And it's not about getting a bad review. It's about like, what's going on? What? Let's help you. Let's get this straightened out. Sometimes we got to help them and do a procedure or do something, and it's no charge to them. It's just something that we have to do to make sure that they're complete, and they're healthy at the end of the day.
We're stuck a little bit on when things go wrong, but really I think aesthetics is it such a great thing for mental health, because when you look good, you feel good. And I don't know that rule is ever going to change.
I don't think it will.
No.
It does feel good to look good. Yeah. I call it the second look. I mean, that is one of the things I talk to patients about, because of the way humans see, you don't see a lot. You're just seeing only what the eyes are focused on. So when somebody gives you a second look, I mean, thank God it's hopefully for a good reason. They're giving you the other second look, maybe not so good. But, you want a second look. You want somebody to notice you. And that's kind of what we're doing all this for, is to be noticed at the end of the day, to be part of the pack and to be recognized. And you're like, hey, you look good,
It's funny. I actually thought you meant when you look at yourself the second time in the mirror, like, did I really like that? Yes, I did really like that.
Hopefully
you can second look yourself.
I like it, but you have to second look at things because our brain is, we have a very narrow vision scope. So if somebody, like I call it like our little Rodeo Drive in Fort Lauderdale is Las Olas. So I'm like, if somebody gives me a second look, I know I did something right here. Unless I look absolutely crazy, who knows? I could be, and I'm delusional. But otherwise, I think we, especially in our field where this has a high premium to it, it's even more important. Again, like I said, I think people just want to be noticed. And I think my first look in the mirror is like, inspect everything.
Like the magnifying mirror look?
I hate doing that. And I actually will have my staff intervene on me because we're all guilty, unless we had a hologram of ourselves, we're seeing such a different image in even the pictures I take of people. The staff we're showing them 6 views of their face before we even see them. They're looking at their face from so many different views because I want them to see what people are seeing. Because ultimately, even if they say, I'm doing it for the mirror, the only people I truly believe do it for the mirror are like 95-year-olds. And they just want every little wrinkle gone. And it's like, if you don't do that, you just ruin their life. You have to kind of just fill for the mirror on that person. But everybody else, it's not. And when you change their life by filling them for how people see them, and they really start encountering the feedback from people will tell them, wow, you're looking so healthy. You look so pretty, and it's putting them into proportion. It's putting them back into shapes that imply young, healthy, and we know those little tricks. That's kind of like the years of experience of learning. This really works. This doesn't work. You can make someone look super unattractive and old by putting too big of lips on them because you're putting them so out of proportion.
Mm-hmm. Very true.
Yeah.
So you said 6 angles. You're using TouchMD, right?
Yeah.
And do you use that for all your photos?
Oh, yeah.
And do you have the Snap Pro now?
Yep.
Okay. Tell me how you're feeling about this. This is a bit of a tangent, but
really, we've been using all this forever. This is our EMR system. And so for those who don't know what EMR system, it's kind of how we use for our medical records because everything we do.
Use TouchMD for all of that?
Everything. Yeah, and they're kind of trying to go EMR, but I think we're writing their EMR systems for them basically because we have all our consents in it. We have all our photos in it. We have all of our phone conversations in it. We have, their registration, how the
app,
everything you could think of. So it really, for us, it has been a fantastic tool forever. It has developed over time, and I'll tell you, weekly, we still struggle with the best photos. For like the first half of this year, we had a photo booth and I'm like, it's still not giving us the pictures that I think are representative. So we took them out. Now we're going back to the rooms and doing them with everything's a black screen. Unless you have the Vizia, which is a lot of work for one, it's very expensive. And to really have a dedicated area, I just find it very hard and difficult. If I were doing plastic surgery, I think you have to do it that way. But for injections and you're taking pictures probably like every month or every couple months, you just kind of are wanting to see what's going on, what's changing, what's working, what's not working. Is something working too well?
One of my favorite things about TouchMD is that I can go back in time and see how much better my face looks.
Yes.
So there's pictures in there from 10 years ago now.
Yes. Yep.
And I look younger and better than I did 10 years ago.
Isn't that amazing?
Wild.
I know. I think people don't really give themselves credit, and that's one of the things that it goes back to the mental health part of this is people, when they're looking good, they don't really give themselves that little, hey, I look good, and they need to, and that's kind of, we try to talk them through that because we want them to see that about themselves. And it's not all about the looks. Hey, you look good. Be good, be a good person. At the end of the day, it's a package and everything is just like we're doing multiple procedures on your face, your body. Your person is a multiple thing.
Tell me a little more about your team and who's working with you every day.
Wow. I have just spectacular people and they are really, I have 2 different offices. The Allenby cosmetic dermatology is more the kind of the extension off of, it was medical derm at one point. And so we kind of still have a little bit of that flavor, but it still seems more like a medical office where BodySquad is more of a very gender neutral, very service oriented, kind of a little more spa feel to it. So it's a very interesting dynamics in each office where in the practice that I work most often is actually Allenby. I'm really with more like, I have the front staff people getting everybody in, greeting. Then I have my MAs who really have a ton of responsibilities. They're kind of the caretaker for the patient the whole time. They're their advocate. They're coming to me like, hey, can we do this for the patient? I'm like, of course. They also do a lot of my I call provider stuff, like radio frequency is done by them. They can do the ultrasound products, which is like soft wave and null therapy. they have a lot of ability to kind of help guide a patient with their skincare. I have a skincare specialist who comes in and gives the whole, this is a good package. And she's older than I am. I'm not going to say she's older, but she looks fantastic. And because she's been doing skincare, it just shows consistency. I've had staff with me for 20 years, then they are just my family away from my family, really. It's just, I am so lucky to have a great staff that people see. And then I have the staff that people don't see, like people that work with my social media. Bridget, who she kind of comes and goes. She's actually more patient oriented in BodySquad, but she is somebody who's behind the scenes putting together some of these fun events that we're doing. If we're working on how are we going to reward patients, we have some things coming up. She's the one who's like behind the scenes getting everything done. I have back staff that people never actually see. So I really have such a great crew. That's more the Allenby office. The BodySquad office, most of the girls kind of are dual purpose. They kind of are doing patient care and they're doing a lot of the administrative work. It's more of a niche office, so they're kind of more limited to the amount of things that they're responsible for, but it becomes very extensive because they have more responsibilities.
And then who's your team at home? Don't you have a dog?
I do, and she's not here with us today. I kind of thought she'd be barking the whole time. I have a 4-year-old, 4-pound Yorkie who is, her name's Allie. She's my little co-pilot. I adore her. She's just, she was a blessing. Honestly, she was from my last Yorkie. My last Yorkie passed away at 16. And I just happened to go into this abandoned pet place that I had been giving to. I'm like, I can just stop by there. Place wasn't like the nicest little place. I'm like in there. I'm like, there's this little 2-pound mess. And I'm like, who is that? They're like, this Yorkie got abandoned. It was abandoned. And it was probably because she ran off. She ran off and she had like every worm, mite.
Oh no.
Her eyes were closed shut. They were just so crusted up with gunk. And I'm like, I just lost my Yorkie. And they're like, okay, go away, lady. And I'm like, I'm a Yorkie mom. I could be a Yorkie mom for her. And so I had to go through all the process of getting vetted out. And I really think my last Yorkie sent her to me because it was just like the likelihood of getting a Yorkie at 4 pounds. She's like 4 years old and she's 4 pounds. So they don't have those ever. And she is just such a personality.
Yours.
No, she's the personality of a lion. She is just like, I'm going to protect you, mom, all the time. But she's actually in the last couple months, she's kind of mellowing a little bit. I don't know if her teeth are going bad. I got to go get her checked, but she's she's getting a little more gentle natured. And
does she ever go to work with you?
Oh, every day.
Every day.
Yeah, she's there. We are pretty dog friendly in the office. We definitely, I do have patients who bring their pets with them. And, as long as we're staying clean, I'm fine with that.
Did you grow up in Florida or were you from somewhere else?
Yeah, I am from New Mexico originally. I know it's kind of a weird spot. No, nobody ever does. I don't think you get out of New Mexico usually. So my family's from New Mexico and my mom moved off to Oklahoma. My dad moved to Chicago and I kind of split up time growing up there. Ended up more in Oklahoma because my mom was there. Went to college there, Oklahoma State, started medical school in Oklahoma. And then, I'm one of those came to spring break in South Florida things. So
that's how it
went to spring break. I'm like, I'm coming here. This is fun. Okay, from Oklahoma to here. Come on. That's an easy choice. So ended up here. And that was back in 1989 is how long I transferred medical school and came down here and never left.
The rest is history.
Yeah, that is. Yeah, I wouldn't leave.
Great story.
Yeah.
And it's Oklahoma, I don't know about New Mexico as much as Oklahoma. It's a good place to be from.
Yeah. The nicest people you'll ever meet. I mean, when I got here, I was like, hi to everybody. And they're like, who is this weirdo? Here you don't say hi to people unless you're looking to get robbed or something.
Really? It's like New York South. Don't look.
Yeah. This is just South New York for sure.
Oh, that's sad. I know Seattle's like that too.
Really?
Yeah, I had gone from Texas to Seattle, and I was like,
"Texas is the same.
I'm here,
right?
Hi,
right."
And people just look at the ground. Why is she talking to me?
I know. Yeah, I feel sad for them. I really because My whole life seems to be about wanting to make people feel good about themselves. So if I can see them smile, like that makes me happy.
Yeah, you're in the right place.
Yeah.
If someone's listening today and they want to find out more about you or come visit you at the practice, where should they look for more
Wow.
information?
Allenby Dermatology Instagram is a great place. We put a lot out there. We're on Facebook. We have for Allenby Cosmetic Dermatology and BodySquad. And we have TikTok. We have podcasts out there. We have pretty much any social media platform. If you look up Allenby Dermatology or the BodySquad, you will find information on us.
I will put all those links in the show notes to make it easy.
Thank you. Appreciate that.
Thank you so much for joining us today,
Yeah,
Dr. Allenby. It was good to catch up.
Yeah, it was so good chatting.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.